Leif Rustvold. I'm a data scientist at a research organization in a large medical group. What makes my job interesting is I get to answer new and novel questions with data, and that there's always new data and new questions to answer.
My name is Nikki Olson, and I work at a research center in a large hospital system. And what makes my job interesting is working with a bunch of different people with different backgrounds. We can all work collaboratively to understand how to answer difficult questions and do things more efficiently and effectively to help our communities.
Previous 19 years was in finance, so I'm new to this part, and it's actually very interesting in the sense that it does have direct impacts in the communities around us, and I'm excited to make those impacts.
Hi, my name is Chalwa Yu, and what makes my job interesting is that I actually have a degree in biomedical informatics with a clinical informatics focus, and I feel like this is a job where I am able to reap the benefits of my experience in education.
My background is in statistics and bioinformatics. I have a 15-year career focused in computationally intensive modeling of biological and medical data. Now that's focused on, in the bioinformatic realm, on large data sets from mass spectrometry, and then more recently in more focus in public health and actionable information about what's happening in the health system. Presently, focused first in large surveys and population health studies, and now increasingly in claims analysis and large medical data sets.
After a long stint in the basic sciences in a behavioral neuroscience lab, I decided to make the transition to medical informatics. This was driven by an interest in cognitive psychology, which I had a bachelor's in. I spent a number of years in the public health arena working as a medical informaticist in the maternal and child health section, and decided to take my skills more into the nonprofit sector.
I'm probably the most removed from the initial profession. I actually started in information technologies. I was developing, new computer systems as well as new software and data architectures for that. Again, I was so focused mostly in information systems for large financial corporations. I guess I got tired of large corporations and wanted to have a more impact on people's lives directly rather than indirectly, maybe adversely affecting them. So that's been my focus. I've just been excited to be here and to be learning about new ways to make an impact. With the state organization, it was a good start. I did develop some things that actually did have an impact, people getting coverage to care and things of that nature, and I could see the tangible effects.
My background is in research science, particularly in the field of sociology, focused largely on understanding how people's lives and the experiences that they have are related to their health, and then how the different policies and systems that we set up impact that as well.
I think it's a multidisciplinary effort. Computational skills are very important, the ability to organize and analyze data and the tools to do that. But at the same time, the analytical thinking and the knowledge about the data that you're working with are crucially important. So the ability to build the skills to work with that information and then have the knowledge to really exploit it for the kind of answers it can offer.
More directly, making the transition from an IT background to this is that there is a great deal to learn that's a little different. If you approach it in the same way that you approach any other systems, you can actually look at what drives an effect and a cause of some of the data or information. So you can actually see some of that, having any kind of background to come in. There's a great deal of learning, though, as to the way the data is organized and it's handled, and there's typically a great deal more amount of data that you have to look at and weed through. And it's not always clean, so there is some of the interpretive skills, or as Leif said, the analytic skills to kind of see something and say that this doesn't belong, it maybe belongs somewhere else. It does have a big impact. And it's a big transition, but it certainly is interesting.
Building off of that, I would say that there's a truism that is passed around the informatics program where I got my degree, and that technology is actually the easier part of that equation, and that understanding the organizational constraints, understanding the personnel involved, and most importantly, understanding the context from which data comes from is a very key part of the problem, and that context is crucial for understanding the implications of that data. And in that regard, learning some anthropological skills or learning some people skills and investigative interviewing skills is very, very helpful.
And just to build off of what they're saying, and this is the idea right here, is building off of our different backgrounds, and that's the central focus. What we do is that really we're approaching an era where it really does take the depth that different disciplines bring in order to solve the new problems. So if we try to have a shallow understanding of all of them, or just a siloed deep understanding of one, we're not actually going to get to the next level. So that's what I would say, is that try to find opportunities in your learning where you're touching into other subjects so you can understand what would be leveraged from those viewpoints.
I think that negotiation and mediation skills would have been served me at my former job. I think that when I went into this job, it was the first job out of school, that we encountered a surprising amount of resistance and a lot of people entrenched in the old way of doing things. Not at this current job, this dude's great. But at my old job, people were slightly resistant to healthcare information and were frankly scared of new technologies. And so negotiation, mediation skills would have served me well in my education. We had a lot of training in interpreting and communicating stuff, but I still think that overcoming the politics that come with introducing new systems would have been helpful.
I would build on that. I think this was a part of my background, but I would just emphasize its use is really understanding technical writing and communication skills, because the ability to be precise and clear about the decisions you've made when you're communicating information is really critical to the accurate interpretation of it. And I do find that technical writing skills or ways of kind of notating what you've done are really powerful and a straightforward thing to be able to learn. So I think that kind of goes hand in hand with what Chow said, in that trying to communicate with others and in new ways, the ability to document that is really critical.
I think I never realized how much there's a tendency to think that the data speaks for itself, and that you just have to bring the information out of it that you require, but we really speak for the data, and we have to say how the data answers the questions that are important today. And as building on what Chow had mentioned, understanding how the data came to be is just as important as understanding how to get answers out of it, for knowing what it can tell you and how it can tell you it.
A lot of what they've been saying is very accurate. I mean, you need to have the negotiation skills, because it's not just even your cohorts or people when you've written a paper or something on the information and said, here's what I can see. You also need to negotiate trying to get the data and trying to get that understanding. And there's a great deal more to getting accurate information out of the system, whether it's from, claims analytics, or if it's surveys or other kinds of data that you can be using to help judge where we're going in our health as a society. It's very important to get good and accurate data.
I have something to that, because I like where we're going with this. It's helping me think. I do think a big part of the skill set too is being able to be someone who can connect as a person and build trust. And a lot of the way that people think about data, often it causes a lot of anxiety, it causes a lot of discomfort, and having the ability to speak to where the data came from, your deeper understanding of what it means, and that you know how to use it or not use it properly, and build bridges with people who are data experts on that particular source, really allows for people to be more comfortable with what's being done and to trust in the interpretation of it.
We need more information to continue to build on making our communities healthier and stronger going forward, and data research is really where it's going to come from to help drive the political backgrounds to say that something should be done in this area, and then without that, some people are just going to be left out.
Technology is expensive, cutting edge technology is expensive, and sometimes the different organizations that might be trying really hard to answer difficult questions don't necessarily have the right funding to be able to leverage some of those things. So I think there's some more work that can be done to bring people who have the passion and knowledge for what these sort of good for our health community questions would be, and bringing the right tools to the organizations or groups that are trying to do it.
I think that there needs to be a bigger focus on the healthcare system writ large as opposed to just clinicians, MDs in particular. I think that it should include the allied health professionals and people that we don't normally think of as caregivers, like folks, community health workers and stuff like that. They all need to be included in this web of technology, and they can also benefit greatly from it. I think that everyone can benefit from, especially the population, from a sharing of knowledge, a sharing of enabling healthcare coordination, and making sure that community wellness can be a reality.
I would say that technical skills are important, but curiosity, innovation, creativity are key elements in understanding how to ask the right questions and finding ways to answer them.